70 years ago, the Faculty of Medicine and Health Sciences at Stellenbosch University began as a modest ambition on a quiet campus in Cape Town's northern suburbs. Today, that humble start has grown into a world-class training and research hub, a trusted voice in the global health conversation, and a tireless champion for the health of South Africans. The Faculty of Medicine and Health Sciences opened its doors in 1956. While students and staff worked from Karl Bremer, a purpose-built medical and academic complex was taking shape at Tygerberg. This would eventually become the Tygerberg Hospital Complex and Stellenbosch University's Tygerberg campus we know today. Like many institutions of its time, the faculty reflected South Africa's political climate and was established to train Afrikaans-speaking doctors. At the same time, it carried a broader purpose, which was to strengthen medical research in South Africa. The faculty's founding dean, Dr. Francie van Zyl, played a key role in these early years. He helped grow the facility from just 19 students into a fully functioning training institution for medical doctors and other healthcare workers. As the faculty expanded, so did its academic offering. The occupational therapy program was introduced in 1961, the nursing program in 1963, and the physiotherapy program in 1969. Dr. van Zyl remained closely involved in the planning of the Tygerberg campus, but sadly passed away in 1971 before its completion. His legacy remains visible today in the residence that carries his name. In 1968, a Faculty of Dentistry was established at Tygerberg. This marked the start of a long-standing partnership between the neighboring faculties. By 1972, the dietetics program had moved to Tygerberg, further strengthening the Faculty of Medicine and Health Sciences offering. Prof. Andries Brink succeeded van Zyl as dean and brought a strong focus on research. At the same time, he served as part-time president of the newly established South African Medical Research Council. One of his lasting contributions was the introduction of the annual Academic Day, where staff and students still showcase their research. In 1973, the faculty's move into the Tygerberg facilities was completed. This was more than a relocation. It was the definitive turning point that accelerated the faculty's growth and established its footprint in the health sciences.
I started MBCHB, medical student, in 1978 and finished in 1983. Things have changed remarkably. In 1978 was an interesting time both in the history of our university and also in the history of our country. In the university and in the medical school was the first time that there were colored students admitted to MBCHB. I am the very first alumnus of this faculty that then became a rector and vice chancellor. So I think I was certainly shaped by this faculty. This is a much better medical school than the one that I'd attended in so many different spheres, in terms of diversity, in terms of inclusivity, in terms of excellence, in terms of its international reach and how it really is now a global player as a research-intensive faculty.
In 1984, Prof. H.P. Wasserman became the faculty dean and continued to build on the strong academic and clinical foundation already in place.
In the late 80s, South Africa was still in very deep apartheid years. There was a state of emergency, and we were totally isolated from the rest of the world. In fact, it was really hard to publish an article in an international journal, if at all possible. Demography was very different. There was no diversity. It was a male-run faculty. Diversity has changed. There are now many more women. It is much more diverse with different groups of people. I think it's very exciting because different groups and different cultures bring new ideas.
Under Wasserman's leadership, the faculty continued to expand. The speech-language therapy undergraduate program was introduced in 1988. The Department of Family Medicine and Human Nutrition was also added. New facilities included a student center, a bioengineering bureau, a craniofacial surgery unit, and an experimental animal center. In 1993, Prof. Vaki du Toit became dean at a time when South Africa was undergoing major political change. The country's first democratic elections in 1994 led to shifts in the healthcare system and the redistribution of resources to serve the broader South African population. Du Toit's tenure was cut short by his passing in 1995. He was succeeded by Prof. Jan Lochner, who guided the faculty through a period of uncertainty and transition. Prof. Wynand van der Merwe took the lead as dean in 2001, steering the faculty through a period of reform in both healthcare and education. Most notably, he oversaw the merger of the faculties of medicine and dentistry, consolidating 5 schools into a single unified faculty of health sciences. Further national restructuring in 2004 saw dentistry and nursing training merge with programs at the University of the Western Cape. By prioritizing stability and efficiency, van der Merwe prepared the faculty for a new era of growth. This period saw a visible shift in representation. 1997 marked the appointment of our first professor of color, Prof. Shabir Wadi, followed in 2005 by Prof. Quinette Lowe, the first woman of color appointed to the professoriate. From the late 1990s into the 2000s, the faculty expanded its training beyond major hospitals and into communities. This took shape through the Ukwanda Center for Rural Health in 2002 and Africa's first rural clinical school in Worcester, established in 2011.
In South Africa, between 30 and 40% of our population live in rural areas. In the first part of this century, we agreed that for our students to be able to take up positions and work in rural areas, we would have to train them in rural areas. In 2011, we established the Ukwanda Rural Clinical School. The primary focus of the RCS, as we call it, was to ensure that our students are immersed in rural areas in order that they experience patients, communities, and the health services within rural setting.
In 2011, Prof. Jimmy Volmink was appointed dean. He was the first person of color to hold this position. Volmink's term marked a period of steady growth and meaningful change. Student numbers increased, including at postgraduate level, and success rates remained strong. Research output and funding also grew, strengthening the faculty's international standing. There was also a clear focus on inclusion and access. The faculty became more diverse, while practical steps were taken to support students from rural and underserved communities. This included expanding student accommodation and strengthening academic, financial, and psychological support systems. These developments helped shape a faculty that is more representative, more accessible, and more responsive to the needs of society.
When I arrived here at Stellenbosch, I was conscious that there were very few African senior professors. What I have since realized is that once I then came, like now there are many more. I think that it opened up avenues for others. And then in terms of the faculty, when I compare to then and now, a lot of things have changed, and I've seen the changes that have happened, both even with the students. When you walk around and you look around, it's a different institution. And as we are celebrating 70 years, I think it fits that we are where we are as a faculty.
In recent years, transformation has remained central to the faculty's identity. This has included visible redress initiatives as well as deeper institutional commitments through the faculty charter and efforts to build an inclusive culture. In 2019, the undergraduate nursing program was reintroduced. The faculty continues to renew its academic programs to remain relevant in a changing world.
We sought better graduates, particularly for our South African context. But the curriculum renewal really, I think, started quite a few years ago with the initiation of the Rural Clinical School and the longitudinal research that was done with that start of the Rural Clinical School. It was a substantial innovation in South Africa at the time, and the research that we did gave us a lot of evidence that we could build on as we were looking at doing curriculum renewal across a number of programs. But we also thought about the country's needs. And again, with the move in the National Department of Health towards providing universal health care, we needed to think, what would that mean in terms of the curriculum that we were trying to design? So there were a lot of drivers for this curriculum renewal. So the two main things were social accountability and integration. Curriculum that was fit not only for the 21st century, but also fit for graduates who will be entering the healthcare system only really after 10 years. There were enthusiasts who saw that this was an opportunity to bring in these newer approaches and newer ways of doing things, and that could address the needs of South Africa in a more direct way.
In 2022, Prof. Elmi Muller became the first female dean of the Faculty of Medicine and Health Sciences. The launch of the Biomedical Research Institute in 2024 further strengthened the faculty's position in biomedical science on the African continent.
So I think the combination of clinical question, scientific rigor, and the ability to do research in these cutting-edge fields is what make us a top science faculty and a top healthcare faculty on the continent. We also provide excellent teaching and training, and there's been years and years of experience in pushing the boundaries of teaching and learning in our faculty. At this faculty, we're really trying to have a culture of compassion, but also a culture of excellence in everything we do. I think when you talk about future readiness, it is about being willing to change, to do things in a different way, to think about things differently, to take new opportunities, to take the things that we know and the methods that we know and to put it into a new mold, into a new shape, and to provide that to our students and to the future generations.